Good evening, everyone. Welcome back to GDC classes. So, hope you all are doing good. So, as you all are aware, that GDC has started with the MCQ series, and in last classes we have already done or solved the MCQs of the autonomic nervous system. So, from this video, we'll be starting with the autocoids. Okay, so this is the first video for the MCQs of the autocoids, and let's start with that. Now in this, basically under autocoids, the most of the question will be from histamine part. Okay, so let's start with our first question, that is the histamine may be defined as. So they are asking here the IUPAC name of histamine. Okay, so let's start with our first option. They says that it has an 2-indole 1-aryl-ethinylamine. Then in B option it says 2-imidazole 2-aryl-ethinylamine. Then C, the same, just the position has changed of this chain here, the ethylamine attachment to that imidazole. Okay, and here at D option also they have told that at fourth position. So they are asking that what is the correct name for that. So let's look on to the structure of histamine first. So yeah, this is the structure of histamine. Now it contains an imidazole ring. Okay, so this is an imidazole ring, which is a 5-membered ring with two nitrogen atoms. Okay, and it is an aromatic ring. Now in this imidazole ring, if we start with the numbering, so 1 2 3 4. Okay, so at fourth position of this imidazole ring, we have this substitution or an ethylamine chain attached. Okay, so that is an histamine. Now if we look on to the options again, now they says at first option they says that indole ring. So we don't have indole ring in histamine. So first option we can just remove it from the list. Now second, third and fourth all are same, just the position is different. So they are saying that at second position the substitution is there attached to the imidazole ring, at third or at fourth. So right now only we just saw that at fourth position the substitution is there. Okay, so the answer for that will be the fourth one. Okay, so D option will be the correct option. Now in some sources, if you will know, now most of the books, okay, they says that this particular name is correct. Okay, so they are giving this particular IUPAC name for the histamine, but few official sites like the PubChem, they says that the IUPAC name is 2-imidazole 5-I. Okay, so now you must be thinking that what is correct. So basically both the names are correct, fourth position also and fifth position also. Okay, but according to the IUPAC rule, okay, the IUPSC rule, the fourth position goes better. Okay, so we mostly go with the fourth one, but some weird, like in PubChem I told you that at fifth position it is given. You can even check online in PubChem. At fifth position they have given this imidazole ring. Okay, and the substitution in the imidazole ring. So that's okay, both are correct, but we prefer the fourth one. Okay, now moving to the next question. Now this question is also from the IUPAC. Okay, so they says 2,4-chlorophenyl pyridine 2-aryl-methoxy, then N-dimethylethanamine. So this IUPAC name, it belongs to which drug? It is a carbinoxamine, it is an edrophonium, auronopin, or the tenoxicam. Okay, so which drug basically is the IUPAC name, correct IUPAC name for which drug? So let's look on to the structure. So they have given this structure, that it contains a chlorobenzene, then we have a pyridine, then we have an methoxy, and then ethyl, and then dimethyl. Okay, N dimethyl. Okay, so this particular IUPAC name belongs to the carbinoxamine. Okay, so this is the structure of carbinoxamine, and the IUPAC name that is given, that belongs to the carbinoxamine. Okay, now if you look on to the structure carefully, now if we make small changes in this structure, like if we remove this Cl and remove this N from here. Means two phenyl groups are there. Now this structure is of diphenylhydramine. Okay. Now if we are adding the pyridine ring and chloro here, now this is the structure of carbenoxamine. Okay, so both are the antihistaminic drugs only. Okay, but the structure is different. Okay, even some activities are also. So this was about the carbenoxamine. So the answer here is the A option, that is the carbenoxamine. Now next question we have, the thiophene ring is present in. So they are asking about the thiophene ring. Now which drug contains the thiophene ring? Now before telling that which drug contains thiophene ring, we should know what is thiophene ring. So thiophene ring is basically a 5-membered aromatic ring. Okay, so 5-membered aromatic ring with sulfur as a heteroatom. So here we have a sulfur. So this is the structure of the thiophene. So they are asking that which particular drug contains this thiophene as the heterocyclic ring. So let's look on to their structure one by one. So this is the thiophene ring. Next, the structure. So first option is the pyrilamine. Now pyrilamine basically contains a pyridine ring in its structure, and the second ring is the benzene ring, or we can say the phenyl ring. So it doesn't contain any thiophene ring. Now next we have the methapyrilene. Now methapyrilene contains a pyridine ring plus a thiophene ring. Okay, so methapyrilene, it does contain a thiophene ring in its structure. Next drug we have the triphenylamine. Now triphenylamine, it contains a pyridine ring and a phenyl ring. Okay, so no thiophene ring. Then we have diphenhydramine. Okay, just now I discussed this structure with you, that it contains two phenyl rings and the methoxy group, ethyl chain here. Okay, then dimethyl and N-dimethyl. Okay, so that is diphenhydramine. It also do not contain any thiophene ring. So the answer to this is the B, that is the methapyrilene. Now next question we have the ring present in the fexofenadine. Now fexofenadine, again it is an antihistaminic drug. Now it is also an H1 antihistaminic drug, and it basically is a second generation antihistaminic. Okay, so fexofenadine, so which drug it contains, which ring it contains. So this is the structure of fexofenadine. It contains a benzene ring, or we can say phenyl rings, 3. Okay, so in options I don't think so the phenyl ring was there. Now it also contains a piperidine ring. Okay, so it is a piperidine ring derivative, we can say. So piperidine ring is present there. So it is an antihistaminic. So pyrrole, pyroletine, pyridine, it does not contain all these. It contains a piperidine ring. Next on we have the next question, that is IUPAC name again. So we have to tell what is the drug. The N-dimethyl diphenyl methoxy ethylamine is. Okay, so again, so they are saying ethylamine. So it contains an ethyl group. Okay, then 1, 2, and then an amine is attached here. Okay, then it says N-dimethyl. So they are saying that to this N, 2 methyl groups are attached. Okay, so these are the 2 methyl groups. Then it says diphenyl methoxy. So it says it has a methoxy group and a diphenyl attached to it. Okay, so this structure is basically of diphenhydramine. Okay, I already discussed it with you. Diphenhydramine. So from diphenhydramine we can say that diphen. So diphen means diphenyl. Okay, so this IUPAC name belongs to diphenhydramine. Let me show you the structure. So this is the structure, diphenyl. Then we have an methoxy group. Then we have an ethine chain. Then we have an N attached, that is amine. Then we have 2 methyl groups attached to that N. Okay, so that is diphenhydramine. Now next on, now the first is the answer. Then next on we have the next question, the ring present in diamine-hydrogenate. Now this diamine-hydrogenate, it basically is a drug. It also acts as an antihistaminic drug only, as an antagonist, but this drug is present in a salt form. Okay, and they are asking that what particular ring type is present here, as it indole, furan, xanthine or xanthine. So let's look onto the structure. So this is the diamine-hydrogenate structure. So salt form is present. Here is the positive, here is the negative. Okay. Now it contains the diphenyl rings. Okay. So this diamine-hydrogenate, it is basically a salt of diphenhydramine. Okay. The drug we already discussed, and the 8-chlorotheophylline. Okay, now this can also be important. Okay, it can be also asked as a question, so you should remember that diamine-hydrogenate, it is the salt of diphenhydramine and 8-chlorotheophylline. Okay, now the question was the MCQ, that what ring is present in this. So basically diamine-hydrogenate contain the xanthine ring. Okay, so this is the xanthine ring, and here in its structure the xanthine ring is present. Okay, so the answer is C. Now next question we have that 𝘂𝙀𝙎𝙀 is present as the starting material for the synthesis of. So the question is from synthesis part. Okay, so they are asking about 𝘂𝙀𝙎𝙀. Okay, so let me show you the structure of 𝘂𝙀𝙎𝙀. So picoline, so methyl pyridine is called as picoline, and in that methyl pyridine, if we add an aldehyde group, that becomes picoaldehyde. Okay, now this picoline aldehyde, if we add on, or if we react it with 4-chlorophenyl magnesium bromide, this results in the formation of carbenoxamine. Okay, the structure we already discussed. Okay, that is in the structure is just like the diphenhydramine, just in the place of phenyl ring we have a chlorophenyl and the pyridine ring. Okay, rest of the structure is same. So carbenoxamine is the drug that contains a picoaldehyde as its starting material. Next question we have, in the given structure X will be. So they have given a reaction and they are asking that what will be this X. So they have given diphenyl, okay, then methyl group, then bromo, and then they have given an amine with the 2 methyl groups, a ethyl chain and OH. Now if you look on to both this structure carefully, the X is very simple structure. So basically this Br will be removed from here, this H will be removed from here. So HBr will be released and these two will be joined, and these two will form a diphenyl, then CH joined with O, it will be called as methoxy. Then we have an ethyl, and then we have N dimethyl. So what this structure is? This structure is the diphenhydramine. We have already discussed in the last questions many times. Okay, so the two, when they join together, they will form a diphenhydramine. Okay, now A is the answer. Now next we have the ring present in clemestin is. Now they are asking, clemestin is a drug, it is also an antihistaminic drug. What type of ring is present in its structure? So this is the structure of clemestin. Okay, now it contains 3 rings. So chlorobenzene, okay, a chlorophenyl, then we have a phenyl ring, and here we have a pyrrolidine ring. Now this ring looks like pyrrole only, okay, but don't get confused, it is not a pyrrole ring, as it is not an aromatic. Okay, pyrrole ring is an aromatic ring, but this ring is saturated, so it is not an aromatic ring. So this ring is called as the pyrrolidine. Clemestin contain a pyrrolidine ring plus chlorobenzene and benzene plus, but here the options are not of any benzene or chlorobenzene, so the pyrrolidine is the only ring there. Okay, then we have Benadryl, can be termed as. Now Benadryl, they have given the brand name, they are asking that what drug is marketed as the name Benadryl. So this is the logo for the Benadryl. It is basically used for allergy, and diphenhydramine hydrochloride, the antihistaminic drug. Basically, it is marketed in the name of Benadryl. Okay, so the answer is diphenhydramine. Okay, the slide is not moving. Yeah, so B is the answer. Next, we have the dash isomer of carboxamine. Now, again, they are having the question from carbinoxamine is more active than. So, they are asking that carbinoxamine, it has two isomers, the levo form and the dextro form. So, they are asking that what isomer is more active than the other. So, the levo isomer, okay, of the carbinoxamine is more active than the dextro form. Okay. So let me show you the explanation here. Why the slide is not moving? Wait a second. Yeah, this carbinoxamine. So basically levo versus dextro. So levo form and dextro form, two are present, and the levo form is pharmacologically more active at H1 receptor or responsible for the antihistaminic effect. Okay, and the dextro form is much less active or sometimes considered inactive or weaker than the levo form. Next question we have, which reduction reagent is used during the formation of the chloropyramine? Now they are asking that chloropyramine is a drug, okay? So when during the synthesis of this drug, what reducing agent is used? Okay, so let's look on to the reaction. So this is the reaction which is used for the synthesis of chloropyramine. So in this basically this benzyl chloro or the phenyl chloro attached with this aldehyde, it is reacted with this N dimethyl ethylamine group. Okay, so it is reacted in the presence of a reducing agent, and the reducing agent used here is H2 or the Rennie-nickel. Okay, to form this chloropyramine. So the reducing agent that is used is the 4D option, that is the H2, the Rennie-nickel. Now moving to the next question, ring present in cyclosin. Now cyclosin, again the antihistaminic drug, they are asking the ring that is present in this particular cyclosin. Okay, so cyclosin basically it is an antihistaminic drug. Now if we look onto the structure, so it has two phenyl rings, okay, and one piperazine ring. Okay, so let's look onto the options here. So we do not have any option of the benzene or the phenyl ring, so just we have the piperazine here. So piperazine we can say. Okay, so the six-membered ring with the two heteroatoms that are nitrogen is called as the piperazine. Next question, the diphenylpyrrolene generally undergoes metabolism by. So diphenylpyrrolene, they are saying it undergoes metabolism. So with what particular reagent it undergoes the metabolism? So basically demethylation is there. Okay, so demethylation results in the formation of this metabolism of this diphenhydramine. Next question we have again here. Yeah, the diphenhydramine can be synthesized by the reaction of benzhydryl bromide with. So they are basically asking that what particular reagent that is used along with this benzhydryl bromide to form the diphenhydramine. So let's recall the structure of diphenhydramine. So it basically contains two phenyl groups and methoxy group. Okay, then we have an ethylene bridge. Then we have N or amine group attached with two methyl groups. Okay, that is the structure of diphenhydramine. Now they are saying that so they basically this benzhydryl bromide, they have given this word to confuse you. So basically by benzhydryl bromide, they mean that diphenyl bromide. Okay, so they are saying that two phenyl groups along with a methyl and then bromide is attached to it, that is one reagent. So they are asking along with that reagent what other reagent we need. Okay, so is it a butonic acid? So does the diphenhydramine contain a butonic acid in its structure, any butane chain? I don't think so. So B option can be removed. Then a benzoic acid. So do we need a benzoic acid here? We already have diphenyl group. So benzoic acid, we do not need any phenyl ring or the acid here. So C option can also be removed. Then it says para-aminobenzoic acid. We don't need an amine group. We don't need an benzoic group. Okay, so B option can also be removed. So the option left is 2-dimethylaminoethanol. Yes, we need this. So basically dimethyl, so N dimethyl, so we need this group, and they said aminoethanol. So basically they are saying that ethanol with an amine attached. Okay, so do we need this group to form? Yes. So A is the option. So basically this bromide attached to phenyl ring plus this ethanol group. Okay, so HBr will be removed from here and it will be result in the formation of the diphenhydramine. Okay, now next we have, so A is the answer. Next, merizin can also be termed as, now merizin, that is an brand name again. So which drug basically is the marketed form? Okay, so basically which drug is marketed in the name of merizin? So cyclazine is that drug. So merizin, cyclazine hydrochloride, it is an antiemetic drug. This is the packaging. So it is sold in the name of merizin. Next question now we have of ring present in loratadine. Now loratadine is the another type of drug. Now which ring is present in that? So it contains a triazine ring. Okay, a tricyclic ring. So 3 cycles are there. So tricyclic ring is there. Then we have a ring that is a pyridine ring. Okay, don't get confused by pyridine. Okay, now pyridine is the aromatic ring. Okay, but this ring is piperidine as it is a saturated ring. So this is the piperidine ring, and we have a tricyclic ring attached to that. This is the structure of loratadine. So basically it contains a piperidine ring and the tricyclic ring. Okay, so piperidine. Now you don't get confused by the pyridine here. Okay, now here you will say that this pyridine is also present. But no, here the pyridine, this ring is, yes, it is pyridine ring, but here we are considering it under the tricyclic ring. Okay, that is a part of tricyclic. It comes under the classification of tricyclic histamine. Okay, so here we will consider this piperidine ring only. Okay, so the answer is piperidine, that is D. Next on we have diamenhydrinate is the mixture of. Diamenhydrinate, it is the salt drug. Okay, it is present in the salt form. If you remember, the xanthin was the ring there present. We already solved that question. Okay, so they are asking that it is a mixture of what? So this is basically the synthesis of diamenhydrinate. It is a type of antihistaminic drug, and it basically needs, now this mixture also I told you there. Okay, so I told you that diphenhydramine, okay, so diphenhydramine, when it is reacted with the 8-chlorothiophyllene, remember, if you remember, I told you that in the, when I was telling you the explanation for that. Okay, so I told you that also there, that it is the mixture of two. The salt is formed by the mixture of two things, that is diphenhydramine and 8-chlorothiophyllene. Okay, so diamenhydrinate is the answer for that. So it is the mixture of the diphenhydramine and 8-chlorothiophyllene. Next we have the ring present in carbinoxamine. Now carbinoxamine, we already discussed it so many times, the structure of that. So they are asking the ring that is present in that. Okay, so let me show you the structure. Very familiar structure. It contains a chlorobenzene and a pyridine. So what rings they have? A pyridine ring and the chlorobenzene ring, and the rest of the structure is similar to the diphenhydramine only. Just instead of the phenyl ring, we have the pyridine and the chlorobenzene ring. Okay, so that is the structure of the carbon oxamine, and it contains a pyridine ring as its ring that is present in its structure. Okay, so this was all about the questions from the histamine part. Okay, so hope you understood all the questions that I told you. Okay, the explanation behind that. If you have any problem in any of the question, you can ask me in the comment section. Okay, so thank you so much for watching the video, and for other videos related to this autocoids MCQ series. So we will have more MCQs to this topic also. Then we will move on to the next topics also. So keep on watching GDC. Thank you so much for joining. Thank you everyone. Thank you.